Well, hello everyone, and welcome to today's web conference sponsored by E&I Cooperative Services. My name is Beth Perez, and I'm your meeting administrator. The audience will remain in listen-only mode for the duration of this event. You may submit questions or share comments at any time by using the Q&A or the chat dialog box. We will address questions in the open Q&A segment at the end of the session. All questions not addressed today will be answered offline. Please note the session is being recorded and will be available for future on-demand playback. At this time, I would like to introduce Dave Manns, Business Development Manager with E&I, who will provide opening remarks and introduce our featured speakers. Dave, it's a pleasure to have you with us today.
Perfect. Thank you, Beth, and thank you all for attending. This is a very pertinent topic that is on a lot of our minds. And so we have a lot of things changing, and changing nearly every day, if not every hour. But a few things that really stand true are the fact that we are going to occupy buildings again at some capacity, and want to make sure that those buildings and facilities and campuses are ready for us to be back in them and to make sure that they're healthy themselves. And there's a few areas that we're going to discuss today with Pure Air and Carrier Enterprises, is that the HVAC systems and the surfaces of the building, the new normal of cleaning, is what we're going to discuss. Now, there's a lot of topics that we could get into, but we think that these are really the most relevant in the beginning stages of opening back up. And so with that, we are going to hear from Troy Raszka at Pure Air. He's the Vice President of Marketing, and they've delivered several webinars. And today's is going to be a little different because they're going to be talking about not only the cleaning of these facilities, what they can do, and then what you all can do yourself, but also the testing and certifying of those buildings to make sure that they're clean. And then Carrier, with Rob Gallant, the General Manager, is going to come on after Troy and discuss testing kits that you can use yourself to certify that your buildings are clean, and to give reassurances to the PTA or the students that come in that your buildings have been cleaned and tested. So without further ado, Troy, the floor is yours.
Thank you, David, and thank you, Beth. Welcome, Rob, and all of the guests on today. We hope you find this information useful and relevant, of course. And I'll just jump right in. I've been with Pure Air Control Services for 4 years now, and of course we've been living in this COVID world. Pure Air Control Services, and we'll talk about this a little more at the end of our section, is a full-service indoor air quality company since 1984. We have an environmental laboratory on site in our headquarters that's staffed by a PhD level microbiologist, or our lab director rather. And so we've been living in this world since basically Super Bowl Sunday, since February. We've read a lot of peer-reviewed papers and studies specifically relevant to indoor air quality and the environment. And so the bulk of a lot of this presentation is derived from sort of the predominant thinking on these subjects today. And of course, with my contact information and everything, I'm happy to answer questions or provide links to this peer-reviewed scientific stuff at your leisure if you want to email me. So today we're going to get into this, and we're going to basically look at how these indoor contaminants are transmitted within a building. And so this is not only viral elements, but bacteria, mold, particulate matter, and how all of those things can affect the virus. We're going to look at what are the considerations to make a healthy building. And then we'll look at the environmental management of the indoor environment, as well as some engineered solutions to clean it up. So, and maintain it, really. So first off, if we're looking at how contaminants can be transmitted via the indoor environment, specifically to this COVID issue, we know that wearing masks is important. We know that social distancing has been important, keeping group size down. But, you know, the basic function in modern buildings of an HVAC system is heating, V, ventilation, and then air conditioning. And so that V in HVAC is very important. Most modern buildings these days, they're airtight, and they've been made airtight for energy efficiency considerations, to keep the energy use low in a building when you're heating and cooling it. So, you know, most modern facilities and retrofitted facilities now have, you know, windows that don't open, double paned insulation. And so the bulk of the indoor environment, right, is treated and conditioned via the HVAC system, and ventilation plays a big role. So as you can see on this slide, if someone with a cold, flu, coronavirus would speak, cough, sneeze, some of these droplets, as we know by the social distancing guidelines by the CDC, are going to go around 6 feet and start to drop, and maybe even, you know, closer to that. Those elements can get on touchable surfaces, such as desktops, keyboards, this water coolers, picture, doorknobs, what have you. But some of these particles are going to become free-floating in the air. And the droplets of this virus are very, very small. And on their own, I think they're like less than 0.3 microns, right? And so what happens is they have a tendency to clump together when you sneeze or talk or laugh or cough, right? They clump together, and the heavier ones that clump together are going to fall down. The lighter ones will be disturbed, can get up into the return of the HVAC system, and then be recirculated through the system. And there's papers that have studied this. In fact, a recent one just came out, I think from the University of Oregon, that talks about this very phenomena. And these particles are also known to attach themselves to other larger particles. So dust, any other ambient particles that might be in the room, and they can travel with them. So, you know, and we're going to get into this a little bit more in the environmental management side, but basically what this is saying is you're only as good as the filtration that you have, how clean these systems are, making certain that there's no infiltration around the filter banks, and then we could get really heavily into weeds and start talking about air change rates, bringing in outside air, which in many cases these units are equipped to do. You know, for example, in a healthcare environment, they change the air about 8 times an hour, right? But in a normal building use, office building, school building, your home, the air might only change 4 times an hour, right? So there's been studies that show the more ventilation that you can move through the room, the more these viral elements and contaminants can be taken out. That's why hospitals have a much higher air change rate. Hospitals also bring in outside air and mix it with the air that's being recirculated to help keep the contaminant load low. And again, it just depends on the system in your building. But I don't want to get too deep into the engineering part of it. Just understand that it's human-to-human contact, it's the droplets falling on surfaces, and then it's the droplets being distributed in the air through the ventilation system or through the airflow within a room. So when we look at a healthy building, what it takes to make a healthy building environment, and we can look at things like LEED for our guidelines. We can look at things like the Well Building Institute for guidelines, ASHRAE guidelines, and so on. But we really look at this as a holistic approach to how a building is made healthy and kept healthy. And so we look at the HVAC units themselves, so the equipment, and how clean or fouled that they are. We look at the actual air conveyance system, so the ductwork, the registers, Many times in long runs of ductwork, there are booster fans or what are called VAV terminal boxes that can provide additional heating or cooling boosts. Those can get dirty. And then we start looking at building disinfection and air purification as we move towards below the ceiling, right? And then, of course, this all ties together with a central hub of knowing what your baseline conditions are, and then having ongoing monitoring of those baseline conditions. And all of this works in tandem to create a healthy indoor environment or healthy indoor air quality. So oftentimes in this area, you'll hear the term IAQ, that's indoor air quality, or IEQ, indoor environmental quality. And typically, air quality deals with the air we breathe, whereas the environment deals with everything, surfaces, things that are happening within the walls, other things that we would take care of beyond that. So once we have an understanding of all of these components that goes in to making the building and keeping the building healthy, then we can start to look at how we would manage a situation like COVID-19 coming into our buildings or coming back into our buildings, or preparing our buildings to be as healthy as they can be to accept students and staff back. So again, you know, the environmental management of it is to sort of find those baseline conditions, see if there's any issues, and then focus on those issues to be able to take corrective action on them. So again, we look at building hygiene and performance. Cleanliness, how is the HVAC system performing? Is it maintaining the right temperature and humidity in a room? Are the air changes happening as scheduled? Is there enough airflow or ventilation? These are all things that we look at. And then, of course, are there any environmental concerns, you know, even beyond COVID, but odors, mold, complaints from staff, you know, in certain areas of the building. We look at planning and other important data, and we're going to go through some of these in a little bit more detail. And then again, we look at cleanliness verification. So, you know, we can actually test for coronavirus RNA on surfaces and in the air. We're working on that test as well. And then baseline environmental testing, and then even going into further detail and really looking at how clean and mechanically sound that HVAC equipment is. So, you know, when we look at building hygiene and performance, right, we're going to look at underlying conditions. And again, we've been doing this since 1984. We're a data-driven, science-driven company, so every single piece of work, service contract, anything that we've done, we're taking before and after pictures, we're taking pictures of the work, and these are actual pictures that we've pulled off job sites from over the years, and for every one of these I can give you 1,000, right? So these are actual filters. This is a fan inside the blower of an AC. That's a coil. As you can see, it looks fuzzy, like it's caked up with fuzz and dust. And then this is attempting to look through a piece of ductwork where we have all kinds of cobwebs and dust. So if these systems get this fouled up, what happens is it creates a chain reaction for other microbial elements that can include bacteria, mold, and also harbor or sustain or make the viruses more viable for longer. As long as there's a food source, or as our lab director would say, an energy source for this virus, it can prolong its viability in the environment. So that's why when we talk about building hygiene and performance, we're not just looking at mopping the floors or cleaning off the surfaces, desktops, tabletops, right? We're going above and below the ceiling, as we like to say, to get in these systems and make sure they're clean, because all of these pictures here that you see, all of them affect the air we breathe and what's going on in the environment. You know, a fun side note is that the biggest constituency in dust, what we call common dust. You see it around your house, dust bunnies underneath the couch, dust in these ducts or around the registers of a ductwork is human skin cells. And dead human skin cells, right, create an energy source for bacteria and mold, which can produce odors and even worse type of allergens that can get inside and be distributed through a building. So again, specifically to all these issues, but specifically to COVID-19 or the actual virus that causes it, SARS-CoV-2, these are the environmental concerns that we look at within a building and ongoing if the building's open and we have a positive case, and we'll get into that. But it's high-touch surfaces and objects, right? So anything that the students, staff, teachers, anything that if they're infected, that they would breathe on, spittle would come out, they cough, anything in sort of that 3 to 6 foot radius, these viral elements can fall on them and live for up to 9 days, which was a study published through a German university and into the Journal of Hospital Infection, and they looked at the first SARS virus, SARS-1, from a few years back, and aggregated data on viability for that, and that's how they came up with that determination. The CDC and World Health Organization has refined it, but at the longest point, it's 9 days, and that's dependent on elements like temperature, relative humidity, the type of surface. Is it wood? Is it glass? Is it stainless steel? Is it plastic? But suffice to say, this virus can thrive or live for quite a long time. It's not like it drops and in 5 minutes, it's gone. So that's a big concern, and especially, again, if you have a positive case once a school is reopened, that's something that we want to take into account. And then, of course, as I alluded to in the previous slide, the underlying building or any underlying IAQ issues that we might have. So again, HVAC, air conveyance system, is super important here. And again, we have studies that look at how this virus is affected by the air conveyance system, how it can get into it, how it can be blown around by it. Airflow and building pressurization is an underlying environmental concern. So when we look at a building envelope, which is typically one HVAC zone at a time, but even if we're looking at a multi-story building, right, there's a certain amount of pressurization, and it can either be positively pressured or negatively pressured. So, have you ever walked up to, a room in your office, maybe it's a lecture hall, and you go to pull the door open to enter that room, and it almost feels like it's stuck. And you're like, oh, and then it kind of pops and you go into it. That's because that room is under negative pressure. And so it's holding that door, and you open it up because it's wanting to suck everything into it. So conversely, if it was positively pressured, it would be pushing everything out. So when we talk about this virus or other constituents spreading through a building, the pressurization of a building matters. It's what creates what we would call a stack effect, right? If there's pressurization that's coming in and the building is negatively pressured and is trying to push, suck everything into it, what's going to happen is going to create a stack effect. So it's going to be drawing all of these constituents up to the higher floors. And there's been some theories floated that that's what we've seen with some of the nursing home conditions and some of the things that affected them in like New York City and such on these high-rise buildings, is that this virus spread pretty quickly through there because of how the building was pressurized. And of course, airflow goes into that. And then again, particulates, because the heavier the particulate load in an environment, the more chances there are for other constituents to attach themselves to those particles and then move freely or more freely within that environment. So, those are sort of the concerns we look at when we talk about doing baseline testing. We're going to look at all of that kind of stuff. You want to be aware of making sure that all of those are within optimal operating conditions. And of course, ASHRAE provides a lot of guidelines to that. as well as, CDC even has a whole indoor air quality section on their website as well with lots of good information. Of course, when you would contract someone like Pure Air Controls or another environmental company or an industrial hygiene company to come in and do testing, right, you're going to want to have a lot of data at your fingertips. We're going to ask a lot of questions, certainly. Like I said, we're very scientifically based if we're going to come in and take samples out of the environment and run them through our lab. We're going to want to know a lot of detailed information about the facility that we're coming into to help, whether you're COVID positive or you're not, you're just trying to create that healthy building. So we're going to look at, what the scenario for that building is or what the situation is. Was there a positive case inside of the building? Was it a student? Was it someone on the admin staff? That kind of thing. We're going to look at building use, age, and condition, because those can all be helpful in determining where to look for some of these things I just talked about in the environmental concern section. Total and situational square footage. And so what I mean by that is, so total square footage, if we're going to start to break it out by HVAC zones, we can start to see what equipment is servicing what area. And then situational square footage would be this admin in the athletic department tested positive, and this is where she normally was all the time. These were the bathrooms she used. This was the break room she used. This is her cubicle. There's the copy machine. This is how she gets in and out of the building typically, because we're going to want to know what her traffic flow was, what that traffic pattern was if we're going to come in and do deep level disinfectant, or if you're hiring someone else. So, and then we're going to look at the approximate number of occupants. We would want to know that information. And then we get in to the weeds with actual blueprints, right? Like your HVAC system schedule, or basically your inventory of all the equipment, what it's hooked up to, what areas it services, and that would include all of the ductwork. And then, of course, you'd want to have all of the stakeholders' information on hand so that once we begin assessing the scenario, especially if it's an emergency response situation, we can keep everybody in the loop and everybody's hearing the same thing at the same time. So it cuts down on questions and confusion. We want to make sure everybody's looped in. And so that's sort of how we go about it. We look at, what the environmental conditions are, what are the concerns with those conditions, and then this is, the additional information we're going to need. So when we get into coronavirus, specifically SARS-CoV-2, we have developed through our environmental diagnostic laboratory a coronavirus environmental test. And Rob's going to talk a little bit more about this during his section, especially how to get your hands on a version that you can do it yourself. You can have them stockpiled, ready to go, and pull them right off the shelf if you would have a positive case, you wanted to check it out, or if you wanted to see how your housekeeping staff was doing, you could do this yourself and send it back to the lab, or we could have a building scientist or industrial hygienist come out and do it for you. But anyways, this coronavirus environmental test consists of a swab, and what happens is you go around and you take samples from these high-touch surface areas or these frequently trafficked areas, as you saw in the environmental concern slide, elevator keypads, doorknobs, desktops, you name it, right? The grill of the AC system. And so we're going to take these samples, they're going to be collected, sent back to the lab, and then we use what's called real transcriptive qualitative PCR, or RTQ-PCR, and it looks for the genetic fingerprint, the RNA of SARS-CoV-2 in that sample, right? So it's going to say, yes, it's positive, or no, it's negative, present or not present. And it's not going to be quantitative in that we can tell how much is there. We're just going to be able to say, yep, it's there, or no, you're clear, it's not there. And then typically the lab will take 3 to 5 days to turn around the result, depending on the location. So if you're in California or Oregon and you're sending it back to our lab in Florida, it might there might be some transit time taken into account there, but we certainly can do it much quicker if the need is there, you know, and it's for an additional fee, and you know, it also depends on our capacity. Right now, we're rolling along. We're at good capacity, so we can always take more samples in. We have 4 machines that can do 16 samples at a time, and it takes typically, you know, from the time to process it and get them done, our time on it is typically about 2.5 hours, you know, but then we have to write a report and all of that. So, you know, but we could do it certainly within 24 hours if the need is there. And so that's a definitive, yes, it's present, no, it's not. There's other ways to check for cleanliness verification that could provide clues for viral elements, but it's not going to necessarily tell you that it's coronavirus, right? So you can test for the residual protein, which is an energy source, and can be a byproduct of viral elements through what's called a rapid protein detection test. And again, it's present or not present, and if you see a lot of this protein, then typically that means that there's other living microbials around, because it's either an energy source or a byproduct of that energy being produced by things like bacteria, mold, viruses. And that's the test pictured here. Again, it's a swab-based test, and our industrial hygienists would have these devices, and they'd swab and put it right in, and you would be able to tell if that protein's present or not. We also can do, you know, much more in-depth type of testing that would require an industrial hygienist to be on site to do this type of sample collection. It involves some pretty sophisticated lab equipment, you know, like Petri dishes, like bioaerosol pumps that will take and pump the air across a set number of minutes onto a Petri dish plate, the media, and then that media is sealed, tagged with a chain of custody, and brought into our lab, and then we can actually try to culture it and grow that mold or bacteria or whatever we're looking at on there. So there's a variety of tests that we can perform to look at the cleanliness of the environment itself beyond just the viral element. So, and many of those are included in what we would call baseline environmental testing. And so basically, you know, what that is, it's an indoor environmental evaluation. Again, I alluded to this earlier, but we would base this on HVAC zones, because in a building, those HVAC zones sort of compartmentalize the areas of the building where the air is being recirculated. And we'll look at that and do contaminant source and risk assessment. So we'll look for things like mold, bacteria, other types of allergens, pet dander, insect, detritus, so on, and then we'll provide a risk assessment to see if it is above detectable levels where it might start affecting occupants. We would look at wall and floor moisture testing. Where there's moisture, there's mold, typically, if it's not dealt with. So pipe leaks, water intrusion from roofs, and mold can be nasty and can populate within a building very quickly. I'm sure you've heard of all the student housing horror stories with mold and how it's affected students. We'll do temperature and relative humidity logging. Again, 2 big factors in how microbes thrive within a building, including viruses. We can do infrared thermography, again, to look for air leaks or air intrusion, outside air coming in. That can be done on the ductwork. It can be done on walls, right? And then test and balance reporting. How's the building performing? Is it under too much pressure? Is it under too little pressure? Is the airflow good? You know, these kind of things. And when all told and reported on, it will give a very good picture of where that building or that room is in that point of time, and then would give us indicators on what kind of corrective action to take to make those conditions optimal. And then with an HVAC hygiene assessment, or if we're looking at HVAC cleanliness and performance, it's sort of a mini version of that building health check, where we'd only just look at the HVAC system itself, whereas this type of assessment would be included in a larger baseline study, right? But we're going to look at things like, is there any microbes inside the air handler? It's a cool, damp space. it's moist all of the time. It has a drain pan, and so we see all kinds of things from different kinds of bacteria, Legionella, right, to different kinds of mold like Aspergillus, Stachybotrys, two of the most toxic kinds of mold that affects humans. We look at airflow and energy efficiency. You know, again, airflow directly relates to how the building is ventilated. You want to have a lot of airflow. You don't want any restriction. So that is a big part of this. Duct leakage evaluations, again, where can air come into the ducts if there's holes or they've some of the seals have broke. You know, we want to look at that. Again, building pressure. And then what come out of one of these hygiene assessments is that you'll have a very detailed look at all of the HVAC equipment based on what condition it's in, and then that is very helpful for your facilities folks, your HVAC folks, to be able to prioritize maintenance schedules. And it's very helpful to look at if you're going to be planning to replace units. Sometimes if they're 25 years old, they can be brought back into optimal operating condition, and you could save a lot of money on replacement. Sometimes they just have to go, right? You know, so with all these tight budgets and everything, an HVAC hygiene assessment really can give a good picture and a good roadmap to what needs to happen in that specific arena. And so once we have all of that data, right, to be able to ascertain what's happening in the building, what's happening within the systems, then we can look at what can be done to fix and then continually monitor these systems and these rooms in the buildings. So, and that could include HVAC steam cleaning, hygienic duct cleaning. We're going to look quickly here at disinfectants for emerging pathogens, you know, above and below ceiling disinfection, air purification, and then ongoing monitoring. So when we talk about steam coil cleaning, and again, I don't feel like I need to get into the weeds too deep about some of this stuff. You can certainly email or call me. I'll help you out and go through it if you want to know more information. But the big takeaway of steam coil cleaning or HVAC system cleaning is, one, it's very high temperature. It's an eco-friendly process. We're not using, you know, bleach or foaming chemicals that put off gases or, you know, volatile organic compounds or chemicals, right? So it's high temperature, low pressure steam. And what it does is it essentially turns the whole inside of the unit into an autoclave and disinfects everything at the high temperature. So you know, it's not a pump sprayer with some chemicals that you're just spraying off and making the coils shiny. This steam will penetrate through the coils, drop all of the fouling out, which is then HEPA vacuumed up. And so we've seen very good results over the way that we do our steam cleaning that we've developed, where we're seeing 30% energy efficiency gains just steaming the coils out and dropping microbes by as much as 99.7%. And so we have white papers and case studies that we can certainly share with you to look at the efficacy of steam coil cleaning when compared to just regular pump sprayers or just hosing out the inside of the air handler unit. So very big gains to have for there. We start to talk about duct cleaning. You know, no two, you know, ways of duct cleaning are the same, but the typical way that it's done is they'll take what's called a roto brush that has a vacuum attached to it, agitate all of the dust up into a cloud inside of that section of ductwork, and then attempt to suck that dust into their shop vac or their small vacuum and call it a day. Well, that's duct cleaning. Well, when we talk about hygienic duct cleaning, especially if we're trying to deal with mold or viral elements, you know, you're going to want to, first of all, if you're dealing with mold, the person should be a certified, you know, mold remediator, and Pure Air is certified by NACDA, the National Air Duct Cleaners Association, to be removing mold from ductwork. So we know what we're doing as far as viral elements, these very, you know, pathogenic type of things that can get in there. So, you know, you're going to want to make sure that the area is contained, that no cross-contamination is possible. So we go in, we mask everything off, we put up zipper walls of plastic in the areas, and we go section by section of the ductwork so that there's no cross-contamination. We also do our own particulate monitoring. And so we'll look inside of that containment area and outside of that containment area to make sure that the particle counts are kept low. You know, I was talking about that roto brush. Well, of course, we use them too, and we use pressurized air, but we hook up a big negative air machine at the one end of the ductwork and essentially make the entire duct system for that run that we're working on one giant vacuum cleaner that goes down into a HEPA filter. So anything that we're agitating is going all at once into this big collection device that has a HEPA filter. So pretty cool stuff, pretty high-level stuff, and you're going to want to look for companies that can do that at a hygienic level. We do a lot of duct cleaning in hospitals, and so we're very familiar with ICRAs and other management plans that hospitals have in place in conjunction with their infection control people. And so, you know, this is very high-level duct cleaning, to say the least. Everything that we do anyways, and I would expect this out of certainly in the age of coronavirus, is we do testing and reporting for every job we do. So it's going to include a photo log, it's going to include a job log, hours log, type of equipment we used, and before and after photos. So really cool stuff, very comprehensive stuff. When we start to look at disinfecting, and I'm actually almost done here, a couple quick things is one of the things you might have heard through CDC and various reportings is you're looking for disinfectants for emerging pathogens. And coronavirus snuck up on us, you know, rather quickly. As you know, the government probably takes a long time to test and look at the efficacy of new products that are coming out. So basically all this says is the EPA said if a disinfectant was capable of inactivating a much tougher viral constituent or similar viral constituent to SARS-CoV-2, then it put it on a list to use that was sort of pre-approved. And so that list was called, this is, you know, a list of disinfectants for emerging pathogens. And then if you were a chemical or disinfectant maker, you would submit the paperwork proving, again, that it killed something that was harder to kill, right? And EPA would fast-track it and approve it. So without, again, getting too far detailed into it, and these disinfectants can be used in a spray bottle and wipe. It can be used in a variety of situations. But this is a good chart that shows what's most susceptible to disinfectants and what's most resistant. Coronaviruses are what's known as an enveloped virus. It means it has a lipid fatty layer around the cell that contains the RNA that replicates and spreads the virus. And that's why they even say washing your hands frequently helps, because this fatty layer is very easy to remove, you know, and break down with these different disinfectants. So in the environment, the good news is once, if you identify you have it, or if you have a good cleaning protocol, it's pretty easy to get rid of. You know, it's not going to hang around a lot. You know, mold, on the other hand, can be pretty tricky to get rid of, right? So Pure Air, and you know, probably other companies offer this. We have a multi-level approach to disinfection, and it sort of is a compounding approach. So it's 5 levels, and each level adds another element to it. So, you know, our level 1 would be a tactical electrostatic spraying. We go around the high-touch surface areas. We go around the high-traffic areas and hit the HVAC grills. Then level 2 would include not only, you know, steam cleaning the air handling unit, but then we would also disinfect the ducts with the electrostatic spray. And then as we move up to level 3, we add on level 2 and then do our full level duct cleaning, terminal boxes. We add a basic topical cleaning, and so on. Again, we've done this for many years through H1N1, through SARS, through different situations. We even have devices that can take books off of the shelf. They're like little vacuum chambers, and we can actually disinfect books, files, anything. So we've done courthouses, legal records, libraries, and completely disinfected their entire inventory of stock. So there's been a lot of talk about this when we talk about electrostatic spray disinfection, and we have two methods that we use to do it. We have a portable electrostatic sprayer that lets us walk around. You've probably seen this on the news, but it lets us walk around, be very tactical, and get right into these areas that people touch and interact with most of the time. We're using a series of registered disinfectants for emerging pathogens based on the device that we're using to deploy it. So we have it for different scenarios. We've chosen some of these products because we don't want any harmful byproducts after use. We're an indoor air quality company after all, so we don't want anything residual being there. So, you know, you look at coming in, doing this, it has a pretty short dwell time and then a short half-life. We disinfect our offices every Monday, Wednesday, and Friday. They come in at about 6 in the morning, and by 8:30 when folks are coming here, it's ready to come back into the building. So, you know, pretty quick turnaround on that. And then we have, you know, a larger room fogger, and you'll see these. And now typically then we have to contain the entire area, and you set it off, and it has to run, depending on the room size, anywhere from 20 to 45 minutes, and then it has to dwell, and you have a longer wait time before you can get back into the room and do it and use it again. So, you know, these might be a better use for locker rooms when you know someone's not going to need it for a day or over the weekend, and you can fog the whole room at once and let it sit the proper amount of time before you need to get people back into there. Whereas the handheld is a lot quicker and more tactile. You can go from place to place. So I show this slide because there's been a lot of confusion lately from the CDC themselves talking about electrostatic spray and or disinfection and coverage. And what we did is we did an experiment in our offices with our building sciences folks, and on the left-hand side of the screen, you can see we sprayed this office cubicle down with a spray bottle of disinfectant and then wiped, and then took an infrared shot of where the disinfectant went most. And then on the right, we used our handheld sprayer, and you can see where the disinfectant went after spraying. So the takeaway was, believe it or not, we used less disinfectant, it took less time, and it got that much more coverage off of this electrostatic sprayer that you saw pictured here. So the results are pretty remarkable. It will aerosolize everything that it hits, but it's going up into a big cloud of disinfectant. The other thing about electrostatic spray, again, without getting too far into it, is that it creates a charge on the disinfectant. The effectant, you know, like static electricity, is attracted to the opposite charge, so it goes in between the keys on a keyboard. It goes underneath the desk, underneath the keyboard, underneath the mouse. Anywhere that this fogs, it's attracted to that surface and sticks to it, and then starts to immediately inactivate the microbial constituent or the virus. Again, following our healthy building protocol, then once the building's disinfected, once all of the systems are cleaned, we can look at air purification devices. And so basically, there's, you know, two main kinds, right? There's room-based type of air purification, where they could be wall-mounted, would have multi-stage filters, and then there's more system-based type of air purification that would go inside of the ductwork or HVAC system, and this includes bipolar ionization, and Rob's going to talk a little bit more deeply about that. Then, of course, the piece de la resistance is now you're knowing about the Internet of Things, right, building automation systems, and now we have remote IAQ monitoring. So we can come through and put a series of sensors by each thermostat. So we're looking at HVAC zones, and these sensors phone home to a gateway that uses a cellular network, so it bypasses the internal networks of the university or the K through 12 school system, no firewalls, proxies. It's its own contained system, and it phones home to a dashboard, and it monitors for temperature, relative humidity, particulate, any kind of gases like ozone, CO2, and then volatile organic compounds, or chemical odors. If someone's painting or if they're using, bleach on a floor, these sensors are going to go crazy, right? And so it's placed around the facility. It collects and logs the environmental data. It runs 24/7. It sends it to a cloud. Your facility folks would have access to it. In the case that we're doing this through our IAQ Guard program, then our building sciences would have access to it. And you would set parameters and have it send alerts. So if any one of these baselines goes out of whack, right, and goes into sort of a danger zone, as you can see, they're all set up like little speedometers, and they'll go green, yellow, orange, and red based on the parameters that are being monitored. It'll send an alert to your facility director. It'll send an alert back to us, and then we can go right back to our find and focus stage and see what's going on, and then make the corrective action. So it paints a really holistic picture of what can be done within a building to improve, optimize, and then maintain the environmental quality of the building. So again, thank you for your time. I touched on most of this kind of stuff. I'm sorry if I ran a little bit over, but I do thank you for your time. And next up is Rob Gallant from Carrier Enterprise.
Thanks, Troy. I appreciate it very much. If you want to, you can either send it over to me, or if you want to drive, we can just go that way as well.
All right. Yep, you're in the driver's seat, Rob. Thanks again.
All right. Thanks, Troy. All right. So we're going to switch gears a little bit here and talk where Pure Air was talking about services and things they can do to come in and support your schools and campuses. We're going to talk a little bit more about what things you can do yourselves with your in-house maintenance team and with your in-house facilities team, and then how that may transition over to a service provider like Pure Air. One of the things that we wanted to talk about with CE, just for a moment, we're a distributor, right? So as an HVAC equipment, parts, and supply distributor, we're OEM agnostic, and so our job is to get you and help your schools, your teams get information as they need it as they approach indoor air quality. And one of the places we recommend most they go to is to the ASHRAE requirements, American Society of Heating, Refrigeration, and Air Conditioning Engineers. They've been around since 1894, and they're really the subject matter experts when it comes to a lot of these things. When you look at the SARS-CoV-2 transmission, they're saying, based off the studies, they think it's likely that there's airborne exposure that's going through, and they think there should be some controls put in place, particularly when you look at building operations and you look at the operation of the HVAC systems to reduce the chance of transmission, right? So as Troy mentioned, ventilation and filtration are really important. And if you really work on that and work on reducing that transmission, you can do it to a number of ways, which we're going to talk about. One thing that is not recommended is actually turning off the system. The system in itself really does help you control transmission and the airborne particles. One of the things that we want to look at and talk about is really filter maintenance. And again, it's all about what your in-house teams can do. And it's about the minimum efficiency or reporting value on the filters that are out there. According to the National Air Filter Association, for most schools, they're recommending a MERV 13 rating or better to capture airborne viruses, and that's the ASHRAE standard 52.2. However, one of the issues with that is some systems, because of the air and the pressure drop, can't go to a MERV 13, so you really need to look at a number of different things you can do to control the virus and potential transmission. Before you bring students back on campus, you want to make sure you do a flush out of your system, 48 or 72 hours prior to occupancy further ahead if you can, and make sure if you have any smells or mold or any odors, you want to make sure to replace or clean that filters well before you bring students back on campus. And again, there's guidelines and ASHRAE guidelines that are out there on filters maintenance. You want to make sure you have a regular maintenance program in place with your team where you're documenting what you're doing with regular guideline and cadence. And very importantly, you want to look at ASHRAE standard 55 2017 regarding indoor temperature and humidity ranges recommended for your environment. So there's some really good guidelines there for your teams to follow. And think about your team safety as well. So you want to make sure your staff has proper PPE, you know, the N95 masks, eye protection, disposable gloves, etc. In addition to the filter maintenance and making sure you're doing that and cleaning as Troy had mentioned, we recommend you verify. You know, you trust your cleaning regimen. We also say you should verify and test to make sure that that cleaning regimen is actually working. Another option that you'll hear about out there is the use of HEPA filters, high efficiency particulate air or particulate absorbing filters. And again, these filters get down to contaminants as small as 0.3 microns, and they take out about 99.98% of those microns. That is better than what's called a MERV 16 rating when you look at the basics. However, again, it creates a pressure drop within your systems. So you got to make sure to look at the OEM manufacturer of your HVAC systems to make sure they can handle those filters or not. It's very important that you follow the guidelines of your equipment, whatever your OEM manufacturer might be. And you want to make sure that you know that those systems have to be sealed properly. Many times HEPA units are in filter racks, and they're very delicate, and they take a lot of extra handling from your team. Another potential solution that may be used in conjunction with HEPA filters is mechanical filters, where you're using fans and you're driving air through the filters. In some cases, mechanical filters will use a static electrical charge, and that's, again, that charge is going to, as Troy mentioned, clump the particulates and bring them together so they get caught in the filter, all right? So again, you can increase the efficiency of the filter and try to move up a MERV rating, again, if your OEM or your equipment allows it. But you got to make sure you do your homework before you start just raising the MERV rating you got to make sure you do your homework, right? And again, follow manufacturer specs and instructions for cleaning and replacement. One of the other things you can do in conjunction with the filter replacement is use UV lighting. More and more popular. It's been around in the healthcare industry for years for cleaning instruments. And what it does is it inactivates the bacteria or the fungi organism so it won't replicate or reproduce. It gets down to an optimum wavelength of about 2.65 nanomillimeters, and it's very good against germicidals. Again, it uses a low-pressure vapor lamp, a mercury vapor lamp, but now a lot of the lights coming out are actually LED. You can use it in the ductwork and the upper air systems, surface disinfecting, and again, even portable. So again, it's used in conjunction with great filtration and teams that you handle yourself. And again, you want to make sure your teams are safe and they avoid eye contact, and because you have to be careful with UV, it can cause skin damage, etc. All right. And again, many times it is in conjunction with mechanical filters. Another option is bipolar ionization, and that's where it's a voltage electrode that creates for the ions in the air, and it attacks viruses, and again, it has a clumping effect that helps destroy the reproductive area and then catch it and help them when they clump to catch the items in the filtration system. Some of the systems out there are really effective. There's a system out there called Airnight, which is very, very effective and uses the bipolar ionization. But it's very important if you go down this path, make sure you do your homework and really look at the ozone data around the unit you're looking at. Make sure they have test data because some of the units do create ozone, and you don't want that. Again, we mentioned portable solutions before, and Carrier has a really good negative air machine. And as Troy mentioned, that's about recirculating the air within a room. This particular unit does about 12 times an hour, so it's going to really pull the air in and exchange that air in the room over and over and over again within that hour period. So those type of solutions are out there as well. In addition, and as Troy mentioned, one of the things that CE recommends is you want to trust but verify when it comes to your cleaning regimen involving HVAC systems and coils and things like that. And we are a distributor of the environmental surface testing product that is used, and the lab accreditation is with Pure Air. We do distribution for them. And again, they're an A2LA accredited lab for the environmental surface test for COVID-19. What's really nice about it is it allows you to do confidential detection in your facilities. You can go around behind the cleaners. You can do it on a weekly or biweekly or monthly basis to test various buildings, different high occupancy areas in the buildings, and determine if you have a virus, an active virus on that surface or not. It complements the cleaning regimen, and again, it's designed to give your staff and facility, an extra layer of peace of mind, if you will, that you're doing all your due diligence to take care of them, make sure you got a safe environment. And it really puts, administrators and facility teams back in control of their environment by doing testing, again, as an added layer of protection. So with that, I'm going to turn it over to Beth for a Q&A period. Beth, if you want to go ahead and open that up.
Yep, thank you, Rob. And we're really kind of getting close to being out of time, so I'm just going to combine a couple of similar questions into one. So the first question combo is, do electrostatic sprayers harm keyboards and computer equipment? And have you experienced any issues regarding film residue from hydrostatic sprayers on windows, electronics, etc.?
Thanks. That's an excellent question. And I can say I've been out in the field myself and have filmed some of these jobs taking place and observed how we train our folks. And I have not seen any residue left behind by the electrostatic sprayers that we're using. And I think that's a really important point of contention or difference, is that you're seeing companies like Terminex, right? The insecticide company say, well, we're disinfecting for COVID now. And, well, I guess a virus can be a bug, but, are these folks trained on how to do this within an indoor environment? Or do they know how to use it properly when compared to doing it for, bugs or on the exterior of your house or in your basement or what have you, as a normal exterminator would do? They're not going to exterminate on tabletops and things like that. So, we have a training facility, at least we do at Pure Air, that trains all of our technicians on how to properly use the equipment, what the ratios for mixing the disinfectant is, based on the guidelines, because, you're never putting one-to-one disinfectant in. You're actually, in most cases, cutting it with like a distilled water, right? And so we make sure everyone has the proper amount of training, and they go around. I myself have never seen residue. I've not seen any efficacy studies saying that it harms any sort of electronic equipment or keyboards. We've been doing our offices since the beginning of March, Monday, Wednesday, and Friday. We've had no equipment failure. So I know it's anecdotal, but it's an eyewitness account. So no, I would say it doesn't. But again, you have to follow the guidelines, the recommended dwell time, and then recommended, reoccupancy time. Most of it evaporates. A lot of what we're using is hydrogen peroxide and colloidal silver-based. And so the byproduct of that, as it works on the virus and evaporates, is basically, just, water, oxygen. So yeah, no residual. The other thing to mention is it's a dry mist. And so if or relatively dry mist. It's not like a super soaker or spray gun or something like that where you could put your hand out and it's not even really soaking. It's more of like a fog machine almost type of mist. So that would be my answer to that.
So do you have an opinion about UV disinfection?
I mean, I can feel that as well, at least from our perspective, and that is, I think UV, especially when up against a coil, is very effective superficially, right? Or if it's in maybe a supply or return ductwork ahead of return ductwork, in other words, before everything that's returning back into the air system, before it hits the filters, then anything that's passing through from a particulate aspect, right, is going to be affected by that UV. Now, if it's on the other side of the coil, it's only as good as what the UV is able to touch, right? So, think of it in terms, in some ways, of a farmer's tan. If, make things light a little bit, right? You lift your sleeve up and everywhere the t-shirt sleeve was, you didn't get sunburned. So anything under a coil, anything within a certain depth between the evaporator coil fins, if that light UV can't penetrate it, then it's not effective, right? But so in a room, like for surface applications, in line with the ductwork where it's creating a field of UV that particles are passing through, from everything I've seen, it's highly effective. So it depends on the application and what you're trying to use it for. Rob, any other thoughts?
Yeah, just on the UVC side. So we work with a number of OEM distributors who handle UV lighting that's used in ice machines for folks, on a small scale where you're looking at a 7-inch tube to tubes that are up to 72 inches on a commercial scale. And as Troy mentioned, if you're on a coil, you're going to clean that area. But there's also units that go in the ductwork that clean the air as it passes by. So there's various ways to take a look at it. I highly recommend, and any OEM worth their salt will let you try a UV light for your most challenging situation, let you see the difference in what it's doing before you ever do any large-scale rollout. But highly recommended. It's come a long ways. And, again, the new LED lighting is really, really good and, really scalable depending on what you're trying to do at the school. Thanks, Beth.
Thanks, Rob. And you know what? We really are kind of running out of time, so we're going to take one more question. I will leave the chat and Q&A open after we end the session, so if you have a last-minute question, you may type it in. We'll get back to you with an answer, as soon as we can. So the closing question is, do you know if HEPA filters will be required by the CDC, specifically at K-12 sites?
So, Beth, I'll take that. Go ahead, Troy.
Oh, no, go ahead, Rob. You jumped in.
I was going to say that as of today, no, because many systems cannot handle it from an HVAC system standpoint. It would cause too much of a pressure drop in the system. The CDC, I think, will come out with continued guidelines. And, if you look on the screen there, we look at resources. I would monitor the CDC information, which is up to date and changes daily, as well as the ASHRAE information for new standards. So I think it's going to evolve over time with the virus and how things move forward. But as of right now, no, it's not a requirement. It's a recommendation. Your system can handle it.
Well, thank you, Rob. And thanks, members, for sticking around with us as we ran over. It is a very complex and interesting topic, and I hope you found it as fascinating as I did. So we'll go ahead and conclude our session. Thank you, Rob and Troy, for presenting to us today. As you leave, please take a moment to complete a brief exit survey because we value your feedback very much. Thanks again, everyone, and enjoy the rest of your day.